Social distancing may be working, but the worst is yet to come. Joining us on Columbus on the Record this week, Laura Bischoff, State House reporter for the Dayton Daily News, and Andy Chow, State House reporter for Ohio Public Radio. Welcome to Columbus on the Record. We look a little different. We're trying to keep us apart as much as possible. Laura and Andy join us from remote locations. Laura, Andy, you're both at the State House, correct?
Yeah, I look like I'm in an undisclosed bunker, but actually I'm in the Ohio Legislative Correspondents Association press office here at the State House. OLCO was founded in 1893, and it's the State House Press Corps.
Great. And Landy, you're in the OPR, Ohio Public Radio studios, it looks like.
That's right. We're in the Ohio Public Radio and Television's State House News Bureau audio booth. So this is where we record all of our stories. And
friends of OPR will recognize the buttons behind Andy. That's part of Bill Cohen's longtime correspondent, his button collection. Anyway, as disruptive as these past couple of weeks have been, state officials say the worst is yet to come. As the number of confirmed Ohio cases surpassed 1,000, models predict the state will see up to 10,000 coronavirus cases a day at the peak. The peak is now expected to hit in mid-May. Governor DeWine says the virus spread will really accelerate in 2 weeks, and Ohio could see 3 times as many patients that need hospitalization as we have hospital beds.
We have a long way to go, and that's the stark reality. The good news, our hospitals have all been thinking about this, planning for this, and beginning to move forward.
Ohio now has just more than 1,100 confirmed cases. COVID-19 has claimed 19 lives in Ohio. Laura Bischoff, 10,000 new cases a day. That just seems unreal considering we just topped 1,000 over the past 2 weeks.
Right. Well, the thing is that the infections, they double every 6 days. So if you go from, 1,100 cases now to, have to do the math, 2,200 6 days from now, and then 4,400 12 days from now. It goes on an exponential ramp upward.
Andy, are hospitals ready for this? We saw 3 times capacity, 2 to 3 times capacity, the governor is saying.
At this point, no, hospitals are not ready for it. And that's what the DeWine administration and that's what all the Ohio hospital networks have been candid about, is that they do not, at this current point, have enough capacity to deal with a sharp increase in the number of COVID-19 cases in the state of Ohio. So that's why they're acting right now. And that's why they're working off of modeling instead of just kind of waiting for that ramp up to happen. And so they are at this point ready to build up. They have different response plans in place to start building up capacity. So when that surge hits, Ohio will hopefully be ready for it.
Laura, it was mentioned in the briefing Friday, Governor DeWine mentioned the state is being broken up into 8 segments, 8 zones. And these zones, these counties in those zones are now going to come up with a plan to build what? Temporary hospitals, that kind of thing?
Well, they've kind of, they've given us some broad brush strokes about what's going to happen. They're going to probably rent out floors of hotels. Those might be used to house healthcare workers who need to get rest but don't want to go home and possibly expose their families. College dormitories may be converted into extra hospital beds for non-COVID patients. Say you went to deliver a baby, or you were in an accident and had a broken leg that needed some sort of emergency treatment or whatever. Those people would go to the non-COVID hospitals. And then there would be kind of within each region, like all COVID, all the time hospitals. The governor said that he wants to have the plans worked out from all of the 8 regions on his desk by Monday at noon. And he said that the plans probably would not be posted publicly, but we would get kind of a broad outline of what they're going to look like.
And Andy, the National Guard is going to play some kind of role. Do we know exactly what they're going to be doing? I know the National Guard has been activated and they're helping food pantries distribute food over the past week or so, but what role will National Guard soldiers play in this thing, Andy?
Well, I think the details are still yet to be released, but it sounds like the Ohio National Guard is going to take a big front and center role in all of this. Mainly, like from a top-down approach, the Ohio National Guard is going to be leading the buildup effort. Like Laura just said, the exact plans from all the 8 different regions have yet to be announced. But when those plans do come out, we do expect the head of the Ohio National Guard to be the leader of that buildup effort. And so I think we're going to see a lot of people mobilized here in the state of Ohio working on those buildup efforts. Like Laura said, dormitories, hotels, motels, as whatever space people can find, I think they're going to try to utilize those spaces to be able to build up the capacity to get the amount of beds, to get the rooms that they need. And then the other piece of the puzzle here is the equipment and the personal protective equipment.
Yeah, when you think about the numbers, I mean, if 20% of folks who get COVID-19 need a doctor, need a hospital, and it's 10,000 cases a day, that's 2,000 cases a day going to be seeking either at least a visit to the doctor, possibly a hospital. It just seems an incredible amount of people all looking for medical attention right at the same time. What is the status with the equipment? Because that's what people, the nurses and the doctors and the folks in the hospitals are going to need. First responders are going to need to treat these folks. Laura, what's the status on the equipment?
Well, there's a big concern about PPE, the personal protective equipment. It's the gloves, the masks, the gowns, the surgical masks that you might put on a patient when they come into an ER so they don't spread germs. But mostly it's the N95 masks, these respirator masks that healthcare workers use. And there was a interesting announcement at the Daily Presser with Governor DeWine and Dr. Acton and Lieutenant Governor Husted, is that Battelle is awaiting FDA approval for a new system for sanitizing these masks and reusing them. And if they get the approval from the FDA, which could come any day, they're going to be able to process, I think they have 2 machines that they'll be deploying in Ohio, and they'll be able to process 160,000 masks a day per machine. And then some of the machines, again, if they get FDA approval, they'll deploy those to New York and Seattle and maybe Washington, D.C. as well. Yeah,
that would be incredible if that were to happen. A lot of innovation happening with Battelle, and we did a story this week that Chemical Abstract CAS is opening up its database to pharmaceutical companies trying to find a treatment or even a vaccine for coronavirus. Andy, getting to the stay-at-home order, we're about a week into it. It was Sunday that Governor DeWine made it an order that all non-essential activity in the state had to cease. Non-essential businesses had to close. Is it working?
From all the modeling that the Ohio Department of Health has been using and what we've seen from the data from the Cleveland Clinic, from OSU's Infectious Diseases Institute, they say that all these mitigation efforts, so what you just mentioned, Mike, the stay-at-home order, closing the schools, closing the restaurants and the bars and the gyms and salons, they say that all that mitigation effort, all of that is working. And so when we talk about the peak and when we talk about this idea of seeing up to 10,000 cases of COVID-19 a day by mid-May, that is actually with these mitigation efforts. If we didn't have it, according to the Ohio Department of Health, we would have seen a much, much bigger increase in the surge. We would have seen a much bigger increase in the peak at a much earlier time. So according to the data, according to the modeling, the mitigation is working and it's delaying the spread of the virus. We see it all the time on social media and on charts, flattening the curve. The Ohio Department of Health and all the different hospitals have been saying that with these mitigation efforts, it gives the state time to build up capacity to do the things that Laura and you just talked about, trying to find innovative ways to get more equipment to be able to move the ball forward. It gives everybody more time.
Yeah, Ohio Department of Transportation, ODOT, released a figure. Their transportation monitoring, traffic monitoring system shows that a 45% reduction on the highways since the stay-at-home order started. That's great, but it also means that 55% of the traffic is still out there, Laura. Is the state doing enough? Are they? Because we've heard stories, we've seen stories of many, quote, essential businesses are still open, like nurseries or mattress salespeople. And is the state cracking down enough to keep people home?
You know, it's interesting. The Columbus, the mayor's office, Mayor Ginther's office, put out a press release on Friday afternoon saying that Columbus Health would start to, do more enforcement activities on these businesses that may not meet the definition of essential. Now, that said, that order had tons and tons of listings of what's essential, including like pawnbrokers. Pawnbrokers are considered essential, payday lenders. There's a lot of leeway in that order. And I think one of the most important things is even the essential businesses that do stay open, they're required to have hand sanitizer, soap and water for hand washing, make sure that their workers are spaced 6 feet apart so that they're not crammed into a call center, sharing germs, etc.
Yeah, I know. I went to a donut shop this week, or a coffee shop, and they had the little yellow tape. You had to stay behind the tape to order your coffee. Some car maintenance shops are saying, we're only doing fix-its. We're not going to do the optional repairs until this is over. So if you've got a flat tire, we'll fix it, but we're not going to sell you a whole set of tires right now, at least until this is over. The economic toll of COVID-19 is real for so many Ohioans. In the week after Governor DeWine shut down bars, restaurants, hair salons, and entertainment venues, jobless claims skyrocketed. Look at the last 2 weeks of jobless claims. In the week of March 14th, Ohio had about 7,000 unemployment claims. That's about average. Last week, nearly 188,000 workers filed for unemployment benefits. Indy, that just shows you right there. We knew it was going to be bad, so it's stunning but not surprising. And that doesn't even perhaps tell the whole story, because a lot of people have not been able to get online to apply for benefits, not been able to get through because of the crush.
That's right. State officials have said that the unemployment compensation website, the tool you use to file these claims, has been crashing. And so people who are trying to get their benefits have been waiting in long processing lines, maybe go a day or two, or maybe still haven't been able to file the claim. So that number is expected to be even more. Now, what's interesting is when you compare it to all-time monthly jobless claims, that 1 week number that you just had in that chart is getting close to the most of all time compared to other months. So this is going to be very difficult for Ohio economically. It's something that Governor Mike DeWine, Lieutenant Governor John Husted have discussed a lot. They say that taking care of public health and taking care of the economy do go hand in hand. And so it does come to sort of a balance of what decision do you need to make for the state of Ohio. What Governor Mike DeWine has made very clearly in his public statements is that when it comes to that balance, he errs on the side of public health. When you hear somebody like President Donald Trump and people at the White House saying that the economy plays a big role in this too, DeWine has countered back and argued back at that by saying that not doing anything would create much bigger long-term economic meltdowns compared to what he's saying right now is more of a short-term economic fallout to take care of the most pressing issue, which in their minds, in the minds of a lot of public officials, is the coronavirus.
Yeah, Laura, Mike DeWine says he's on the same page as President Trump, but if he's on the same page, it's a mighty big page. Maybe he's on the other side of the page. He's done, I think, a pretty good job of saying Ohio's going to do its thing. The president can say his thing, but this is what we're going to do in the state of Ohio. This is what I think is best, what his health director thinks is best.
Right. I think that the governor he's in the same boat with other governors across the United States. They just don't want to pick a fight with Donald Trump. It doesn't serve their states well. I think the governor of Michigan said, I can't afford to have a fight with Donald Trump right now. And she's a Democrat. I think that, the governor was saying he's aligned with Donald Trump in that they both want the economy to rebound. They don't want to have these things in place any longer than they're absolutely needed. The question is, who's defining what is needed and when? I think that, Governor DeWine, I think he's looking at obviously a longer haul than the president is.
Laura, does the state have enough money in its unemployment fund to take care of all these people? I'm guessing no, and that's why the federal assistance is needed.
No, the unemployment compensation system has been broken for more than a decade. And a couple of years back, Ohio, the whole thing went broke, and Ohio had to borrow a bunch of money from the feds and then pay it back with interest. I think that ended up costing Ohio maybe $200 million in interest back then. The lawmakers kept promising that they were going to come up with a fix. a long-term fix, and it just has not happened, plain and simple.
Is that because
So
businesses would
still-
have to
they still- they
contribute
still
more
need a
money?
long-term fix.
Yeah. Is that because businesses would have to contribute more money to make it solvent?
There's two fixes, maybe three fixes. Either you raise taxes on businesses, or you have jobless employees accept fewer benefits, or you do a combination of the two.
Yeah.
It's not that hard.
But not popular either. Andy, looking at the
No.
effect on the state budget, I mean, joblessness means no income tax. Nobody going to restaurants and stores means no sales tax. This is really going to bite the state down the road, and local governments as well.
And the state knows it. Governor Mike DeWine knows that he has been very clear in saying, I think it was the day after the stay-at-home order was announced, he during his daily press conference said, listen, we know that state revenues are going to take a huge dip. So they are calling on the state budget. Governor DeWine's calling on his cabinet to seek any type of budget cuts they can make. He's hoping to make about 20% cut in the state budget through the different cabinet cuts, and then he's calling on the legislature to help out. They are freezing any new state hires, they're freezing new state contracts, and really focusing all their energy in any type of spending into coronavirus. But other than that, they are really trying to clamp down, preparing for that loss of revenue.
Yeah,
Well-
and also keep in mind, I was going to say, keep in mind that, Ohio is, the governor just signed into law a change so that income taxes aren't due until July 15th. So that means anybody who hasn't already paid their state income tax has the ability to delay it. So again, that's a huge chunk of money that the state is not going to see for, a couple months beyond what it normally would.
Really, to the end, to the next fiscal year, July 1st. It really will be the next
Right.
fiscal year. What's up with schools? The schools, nobody's in school. I think the governor this week didn't quite want to say kids aren't going back to school this school year, but it's looking very doubtful that kids are going to go back to school before the fall.
Yeah, I can't see that that's gonna, I would expect any day now the governor's gonna say, we've reassessed and we just can't send the kids back just yet.
Yeah, Mike, there's an argument to be made here. There are a lot of school districts who have been saying, listen, if the governor wants to delay, if he wants to continue to keep schools closed, he needs to say it earlier than later. But there are other arguments to be made as to why he would maybe wait and just sort of like look at the situation a little bit further. But he made it very clear that it is very, very likely that schools will continue to remain closed past next week's deadline, which it was supposed to be one more week of closure, and then they were supposed to open. It's pretty clear that schools are going to remain closed.
Not at the peak, more than a month away, according to the latest modeling. Just looking real quickly at Governor DeWine's performance, Baldwin Wallace poll, I know there are questions about its methodology and its accuracy, but this might be a good number to hang your hat on. 58% of Ohioans approve of the way Donald Trump is handling the COVID-19 crisis. Pretty good number, 58%, considering that his approval rating generally is in the low 40s. 80% of Ohioans approve of the way Mike DeWine is handling COVID-19. So it shows you right there the difference, 22% difference, Laura, between how Ohioans look at Mike DeWine, who's been nonpartisan, somber, but also uplifting, and Trump, who's been better lately, but also pretty partisan.
Right, and I think that the president has been telling a lot of people, kind of what they want to hear, that the economy is going to come back by Easter, and that this is, it's not that serious. But then he mixes it in with other messages, and I think it's less clear. I think that Governor DeWine, Lieutenant Governor Husted, Dr. Acton, these daily press conferences at 2:00 have been an effort at clear communication and transparency. And I think that, a lot of Ohioans are tuning into it.
They have a bit of fireside chat feel to them too, Andy. Folksy, talking about the Indians, the Reds, his friends, his wife gives recipes. It's an odd, it's serious, important, deadly serious information, but also sort of down home and kind of folksy.
Yeah, and I think the governor recognizes that, look, this is something that a lot of people are tuning into. There are no sports anymore. There are no movies to go to. So a lot of people are tuning in every day at 2 o'clock for these press briefings. And I think he knows that part of the whole purpose of it is maybe to lift morale a little bit. And so every day he's showing videos. Every day he's sort of trying to be a little bit more folksy, because I think they recognize that they are delivering very harsh, very serious information about a worldwide pandemic, but trying to also lift morale in the process. And it seems to be going over well, like you said, with those polling numbers. And anecdotally, everybody I talked to seemed to really enjoy what's happening. And I think you hit the nail on the head there, Laura, is the idea of he has been very transparent this whole time. And he has always said that when the state learns about something, they will tell the people of Ohio. And so far, that seems to be pretty accurate.
Yeah, it's 80%.
It's funny,
Go ahead, Laura.
I was going to say that there have been memes and T-shirts made about like 2 o'clock is wine with DeWine time. So, like, I saw earlier today that somebody put out like a little bingo card of, let's play DeWine Daily Presser Bingo.
Yeah, like what outfit John Houston, the lieutenant governor, is going to wear. He's going to wear a tie or not. It's pretty funny. Anyway, and Democrats and Republicans both give Mike DeWine in the neighborhood of that 80% approval rating on this COVID-19 situation. So it truly is a bipartisan support of what he's doing. Anyway, one of the big early inconveniences of the shutdown was the cancellation of the March 17th primary. The governor and health director shut it down at the last moment, fearing voting would spread the virus and that people afraid to vote would be disenfranchised. But the voting must go on, and this week lawmakers settled on a way to get ballots cast and counted. Ohioans must now vote by mail if they were registered for the primary and, of course, have not already voted. Here's how it'll work. First, you have to request an application from your local Board of Election. You can go online and print it out, or you can call them, and they will send it to you. Then you fill it out carefully, mail it in, and then the local board will mail you an absentee ballot. You then fill that out and mail it back, and you'll have to pay your own postage. And this all has to be done by April 28th. Voting rights groups don't like this system. They say it's too cumbersome, will take too long, and will disenfranchise voters. They are considering legal action. Laura Bischoff, why mail-in voting only?
Well, I think that there's a feeling that they just don't know when the coronavirus is going to subside and when it would be safe to conduct in-person voting. They might be able to, if they set like June 2nd as the date, or early May, what have you. It could just be that we're still in the same boat as we were on March 17th, where people are afraid to vote. They have concerns about exposing poll workers or voters to the virus, to spreading the virus further. And so they picked April 28th as the new date. And the Governor DeWine and Lieutenant Governor Houston and Ohio Secretary of State Frank LaRose, they would have liked to have had a longer voting window, but this is what the legislators decided on.
And that was because was that because of school levies that are on the ballot and school officials were saying we need to know? Is that basically why they picked April 28th?
Part of the argument was that there are local levies and local issues at play here. And so the local governments, with all the stuff that they're already dealing with, wanted to have more closure a little bit quickly on that. That was the argument. The other issue here is that the Ohio Democratic Party has even said that something earlier than June 2nd was needed so that they could sit delegates for whoever wins the Ohio primary for the Democratic presidential candidacy or the nominee. And so those were a couple of different arguments to be made. But Mike, the situation that you just laid out there, the situation of extending this absentee ballot process, it involves using Postal Service 3 to 5 times. Yeah. And so there are a lot of people out there who say it's just too slow of a process. It's not a long enough window to be able to get through the mail all those different stages.
That's what the League of Women Voters and other groups are saying, and they're thinking about legal action. I don't know if they can at this point, if it would even be productive. But anyway, it's time now for our final off-the-record parting shots, and Andy Chow, we'll let you go first.
I think this announcement of building up hospital capacity is going to be the next leg of everything that you see at these daily press briefings. For a while there, it was all the different public health orders that Mike DeWine and Dr. Amy Acton were handing down. Now the next phase of Ohio's fight against coronavirus is going to be building up capacity.
All right, Laura Bischoff.
Yeah, I think that the fact that Ohio had to, postpone its in-person voting and actually cancel in-person voting and extend the mail-in voting kind of raises the issue on the national level of, how states are able to put on absentee voting elections, given that, sometimes pandemics come in multiple waves. We may get through this wave and we may face another wave in the fall.
Yeah.
And so with the general election looming, I think that states really should consider, some states will consider, and I think other states will be on the fence about it, beefing up their absentee voting systems.
It could be a real mess because states run their elections and not the federal government. On a lighter note, Laura mentioned that every day at 2 o'clock, Governor DeWine has his news conference, and of course, people have been tweeting pictures that they're having wine with DeWine. Of course, many of those people are working from home, which means, of course, that they are drinking at work, right? Not one to judge, not one to judge. Anyway, that is Columbus on the Record for this week. Check us out online, wosu.org. Also continue the conversation on Facebook and Twitter. And if you want to keep it up to date on all of the fast-breaking news on this story, please tune to 89.7 NPR News. Log on to wosu.org and watch us here on WOSU TV. For Laura, for Andy, and for our small crew at WOSU, have a good week and be safe.